Hello, my name is Sandy and I am a midwife. Welcome to the Great Western Hospital Maternity Unit. When you come into the maternity unit, you will arrive at the front reception desk and you will be greeted by a receptionist. We have a receptionist 24 hours a day. I would now like to take you on a tour of our maternity unit. When you come to the hospital in labour, you can use the front main entrance. If you come and the revolving doors are closed, you press the disabled button to open the side doors, which give access 24 hours a day. You need to enter the lifts and exit on the second floor. When you enter the main corridor from the lifts, you will see the entrance to delivery suite on your left side. Outside the delivery door, you will see a button. There is a large button there, which is actually a picture of the small button that you need to press to gain entrance to delivery suite. We have enhanced security to ensure the safety of mothers and babies. Please be patient with us answering the bell, as we may have to leave a room to answer your call. This is an assessment room where you may come initially when you are admitted in labour. When you first come in, the midwife will introduce herself to you. She will ask you some questions about this pregnancy and also regarding this labour. So she may ask you how long your contractions are lasting and how long you've been having contractions for. She will also want to ask other information that's relevant to your care in labour. As part of this admission process, we will check your blood pressure and your temperature and your respiratory rate, and we may use this piece of equipment here to check your blood pressure. It is useful then to be able to feel your tummy to see which way the baby is lying, and we may use this couch to feel your tummy. We will also discuss at this point with you fetal monitoring. To assess your baby's well-being in labour, we have a variety of methods used to monitor the fetal heart rate. If you have no risk factors in your pregnancy or in this labour, research shows that handheld fetal monitoring devices like a Pinard or a sonic aid are as beneficial in detecting the baby's well-being, and in fact there are no differences in outcome between using electronic fetal monitoring. It also allows you to remain more mobile. If you have risk factors in your labour or you have a high-risk pregnancy, the midwife will discuss electronic fetal monitoring with you, and if appropriate, this will be performed during the admission process. Once we have completed these actions, we will then offer you a vaginal examination, which will help to determine where you are in labour. The midwife will offer you the opportunity to discuss your birth plan. Our aim is to make your experience of having your baby the best possible experience that it can be, and to ensure that you have all the information that you need in order to make informed decisions regarding your care. We will discuss your plan of care with you both at all times and involve you in any decisions that are required. Following the initial assessment process, the midwife will then discuss with you the plan of care. If you are in established labour, you will then be moved around to a delivery room. If you are not in labour, it may well be appropriate for you to return back home. Welcome to a delivery room. At the Great Western Hospital, we have 12 delivery rooms. They're all very similar to the room that you can see around you. We have curtains inside each of the room, and what these curtains do is allow us to maintain your privacy and dignity. Each of the rooms has individual lighting that can be adjusted in a variety of ways, so we can tailor that to your requirements. Each of the rooms also has an ensuite bathroom and shower, and this room will be yours for the duration of your stay in the hospital. There is lots of equipment in the room, but all of them have a purpose, so we'll just show you some of these pieces of equipment. As you can see, we have a delivery bed. Now, this bed is really designed to be for when we need to palpate or feel your tummy to see which way the baby is lying, and also for any examinations in labour. Other than that, we would encourage you to be as active as possible in labour and not to be lying down on the bed, because when you're upright and mobile, that will encourage your labour to be quicker and easier for you. So as you can see, we have bean bags that are available for you to adopt other positions. And we also have birthing balls which you can sit on and move around. And all of these things help you to be mobile in labour. We also have a cot in each room. And after a baby is born, we would label the baby with a label with the baby's name and hospital number on, and also we have electronic tags. These are a security system which help to ensure the baby's safety. When these tags are applied, the babies cannot be taken from within the maternity unit into the main corridors of the hospital without an alarm sounding and the doors locking. So this is to safeguard your baby. This is a hospital entertainment system which incorporates a telephone and also television and radio. You can purchase a card which enables you to use this system. We have monitoring equipment for blood pressure and temperature, and we also have Entonox available for your use in labour if you require it. This is an Entonox handset, and we have a mouthpiece that most women will use in labour. Quite easy to use by breathing in and blowing back out into the tube. In each room you will see the same following safety equipment on this piece of the wall. We have suction and oxygen available if required, and we have Entonox which may be used for pain relief in labour. This piece of equipment is called a baby resuscitator. After your baby is born, we recommend that you have skin contact with your baby. This helps to keep the baby warm, regulates the baby's breathing, and also reassures the baby. Very occasionally, babies may require a little bit of extra assistance after they're born. Because they don't breathe inside the uterus, when they are born, they have to adapt very quickly to learn to breathe for themselves, and the majority of babies do this very easily. Occasionally, we bring the baby over to the resuscitator here. If it requires additional assistance, we have a heater and some oxygen to assist the baby. This piece of equipment here is electronic fetal monitoring, or you may hear it called CTG. This is appropriate for women who have risk factors in labour that require additional monitoring of the baby during labour. Your midwife will be present with you during labour. Occasionally she may need to leave the room to fetch equipment or to do some paperwork. If you require her at any time, each room has a call bell that can be used to summon assistance. This is the pool room. As you can see, we have a nice large pool. Many women like to use water for pain relief in labour. The warmth of the water is very soothing, and also it allows you to move around easily during labour and supports the weight of the baby. Your partner is welcome to go into the pool with you, although we do ask that they bring their normal swimwear with them to wear. As you can see, we have all the usual equipment that is found in the other delivery rooms, and some of that can be hidden away when required.